Hello and welcome to another wonderful episode of the Reflection Show. Today I'm super excited. You know why? Because we're going to talk about one of the trending topics or issues that affects young people in the world, HIV/AIDS. Because of COVID-19, a lot of us have forgotten that there's something called HIV/AIDS and we are living our lives carelessly. But there are more infections going on that a lot of us are really going to regret of the way we have lived our lives over the past few months. My name is Martha Anabila. It's always a pleasure to reach you with the Reflection Show. I have been joined here in the studio with Mr. Nuhu Musa. He's a technical coordinator of the Ghana AIDS Commission, Technical Support Unit for Northern, Savannah, and Northeast regions. He's a big man. I have the right people, and I always do have the right people in my studio to give us nothing but the best of education on all the content that we bring to your doorstep. So I want us to go for a break. When we come back, we delve into the discussion. Do stay tuned.
My name is Dr. Emmanuel Kambere Ujaki, the CEO of Zoe Medical Center, Tamale and at Brownville. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or retain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we can.
Thank you for staying with us. My name is Martha Anabila. Before we get into the discussion, let's say a very big thank you to Vipek Beauty Salon for my beautiful hair, Makeup Marvin for my beautiful makeup, Roots Youth and more for my wonderful dress. It's an HIV/AIDS episode, so I am ready for us to know that this topic is very important for all of us to learn. My shoes by Ennis Collections and our refreshments here is supported by Tilium Industry Company Limited, and you can call patients on 0241 760 975 for wonderful packages. Zoe Medical Center, thank you very much for supporting us, and Dio Restaurant for giving us sumptuous meals for us to feel strong and hyper each day we are recording the Reflection Show. You can locate Dio Restaurant on the Tamale Agrek main traffic here in Tamale. Call them on 055 7035 336. If you want to support or partner or sponsor the Reflection Show, send us a WhatsApp message. Mr. Nuhu Musa, thank you very much for joining us on this episode.
Thank you. I'm glad. I'm happy to be part of the show and to be here.
So HIV/AIDS, we've heard of the Ghana AIDS Commission doing a lot of things, but I think for the past 1 year, I've not been hearing so much about it because someone said that the senior brother of all the illness in the world came, coronavirus. So quickly into the discussion. Now, why should we still see HIV/AIDS as a health issue among young people especially? What is the impact HIV/AIDS is making on young people?
Yes, thank you very much. As I said, we are very happy to be part of this show. HIV and AIDS is still very critical for us as a country. That is what we need to recognize. In fact, let me take you back to 2019, for example. As we speak, the only data that we are using to inform our strategies and whatever that we are doing currently is informed by the various sentinel surveys that we conducted in 2019.
Okay.
Now, if you look at the subnational estimates, now this is an estimate that we do to project whatever we are as far as HIV/AIDS programs and issues are concerned. Now, if you look at that report, the report tells us that in 2019, over 20,000 people were newly infected with HIV.
20,000.
20,000.
Wow.
Over 20,000 people were infected with HIV. That alone should tell us that HIV is still with us, and therefore it is still an issue.
Okay.
Now, if you look at that data, 85% of those who were infected it was among the adults population. Now, if you look at the youth, for example, 28% of the new infections that were recorded were among the youth, 15 to 24.
Wow.
And only 15% were among the children. This is very critical.
Yeah.
And to think that we are still having this number of new infections being recorded as a country, and to narrow down to the youth, 28% of the infections coming from the youth should tell us that HIV is still an issue. Now, if you look at the HIV Sentinel Survey report that is being done every year by the National AIDS Control Program, that report also indicated that as a country, we had 2% of HIV prevalence in Ghana.
Okay.
That was a reduction from 2.1% in 2019. So we had a reduction of HIV prevalence.
Compared to over the previous years.
Exactly.
Okay, so there was a
compared to
reduction,
2018, for example.
17, 16, and backwards. Okay.
No, compared to 2017 and 18. 2019, we had 2% HIV prevalence. And interesting in this report was the fact that for the first time, they tried to look at where is the infections are coming from as far as the marriage status is concerned.
Okay.
And that report revealed that among the single, we had 2.6% of the new infections coming from the single.
That's those who are not married.
Those who are not married.
Oh, okay. Like the boyfriend, girlfriend.
Girlfriend, and what have you. And 2.1% were coming from the marriage couple, married people. And only 1.8% were coming from cohabiting, partners, those who are cohabiting.
Okay.
If you look at this data, this report, it tells you that HIV and AIDS is still a huge issue for us as a country. And over 13,000 people died as a result of AIDS-related causes.
Okay, so if I get you, it means that most of the HIV infections are from sexual activities, even though from schools, per the report, from marriage or singles or relationship, it would mean that for us to have even though in school we are told that using sharp objects with an infected person and all of that, but we see a very high rate in people who engage in unprotected sex.
Exactly, and that is very critical. And also to think that the high figures in terms of percentages are coming from the single. I think you will not be wrong to say that it is coming. And also to take note of the fact that if you look at in percentage-wise, unprotected sex is where we are recording a high rate of HIV transmission. So you will not be wrong to say that a lot of the infections are coming from sex. But
do you think education has declined? Because personally, I haven't heard so much about HIV/AIDS in the last 1 year or so because of coronavirus. Do you think that you declined in your duties at Ghana AIDS Commission?
No, we haven't at all. As a country, sometimes you have to look at the dynamics within the country. You have to contextualize whatever that you do as a country and as regions. COVID-19 was huge. And if you look at the rate of people, the risk of dying as a result of COVID infection, as a country, we needed to just prioritize, in that direction. So that
COVID-19 risk is more than HIV risk?
However, HIV now is a condition. It's not like how we used to, the
No,
perception about HIV. It's not more like as it used to be. It's a condition. You are infected with HIV. You live with it for the rest of your life, but it is being managed. And then you can continue to live a normal life. You know, and you can have sex, you can do whatever, you can give birth to children with an HIV infection. You live a normal life,
Yeah.
HIV infection. But COVID-19 was kind of, if you get infected, there's
within
the
few
risk
days
of,
you would,
you know, all those
you
things.
can know what you
Exactly.
can't.
But you see, as a commission, we have never relent on our efforts to continue to do what we do to make sure that we have effective coordination and monitoring of the HIV and AIDS programs and issues. We are still around. 2 weeks ago, we tried to reach out to everybody. Okay, so we have been getting in touch with schools, in touch with religious groupings, traditional authorities, just try to implement something to make sure that the HIV is still an issue in the public space and that people are still mindful and be aware of HIV.
What can we do to reduce HIV infections? Because looking at everything that you've said per the report and all of that, I see that young people are more of the carriers in infecting one person to the other. So what can we do to reduce HIV infections?
Now, it's very critical, especially if we narrow down to young people. Now, this is a very huge concern, especially if you look at the data, as I mentioned. And so for us as young people, I think that we have to live uninformed lives. The first thing is to know your HIV status. It's very critical. In fact, we always say that if you don't know your HIV status, then your life is incomplete. So your life is incomplete if you don't know your HIV status. The first thing is that we need to strive and to make sure that we know our HIV status. That is very critical. You see, it's not just about knowing your HIV status, but you must live a life, our behaviors. Young people
not put you at risk.
Exactly. We kind of live a risky behaviors.
We don't care.
That is putting us at a very high risk of HIV infection. So we need to be very careful. We need to make good use of condom. You know, in the past, we have tried to talk about condom, and some of our religious groupings and so many people, even some parents, kind of frowned about, you know, condom issues. But this is very critical. We started by saying that people should abstain from sex and all these risky behaviors, but unfortunately, it's not working. It's not working because if you look at teenage pregnancy, if you look at the sexual behavior,
it's not working because
it's not working.
We are not abstaining.
So I think that the best is to get hold of the condom. You see, the condom is such that not just HIV, but other STIs, STDs.
It's a universal protection
and
against
then even
pregnancy
this
and
early
STIs.
pregnancy and all those things. So the very important is condom. If we try to change our lifestyle, moderate it in a way that, so that the young people will really understand and appreciate
their
condom.
life,
You see,
so
especially condom issue. Now, when we are talking about condom, we're not just talking to the young people alone. We are talking to duty bearers. We are talking to the parents. You see, we should, in my car, for example, there's no way I'll move with that car. So anytime I get to the house and they are taking my computer, my bag from the children, they see condom, and in my room, condom is everywhere.
Your kids see condoms around.
What is it? What is important is for them to live an informed lives. They need to understand that condom is used when there's a need for it. I need to use condom when I want to have sex and I don't want to become pregnant. I need condom when I want to have sex and I don't want to get infected with any sexual transmitted diseases, especially with HIV.
So
it's very critical.
Yes, not to cut you. So it's like the religious leaders or bodies are not really supporting the Ghana AIDS Commission in that aspect, because sometimes it's difficult to let them understand, them to use, help them to reach out to young people to use condoms.
Let me say that in the beginning, it was difficult, especially with regards to condom use. You know, trying to penetrate through these groupings. But now, just the last program we have with the young people was organized by the Catholic Church.
Wow. And you shared condoms in the church?
That particular program, we didn't share condom. But the previous one that they have organized, you know, those who expressed the need for the condom, we gave them. Now, it means that we are having a very good way forward. Now the religious groupings are now appreciating the need for us to penetrate through their groupings and their programs so that we can share information about HIV and AIDS so that we can work together. They have been very supportive. They have helped us in the past. But with regards to condom, we want to have a new direction such that parents, duty bearers will be talking about condom.
Talking about education, I would come back to that, but I want us to go for a break. When we come back, we're going to look at what measures or what forms of education strategies is the Ghana AIDS Commission implementing, and if education alone is enough to help young people to either abstain or to use condoms. Stay tuned, we'll be back.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Marcus King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Yele, yele, yela, yele. Praise the Lord, Whoa. Yeah. Are you ready? Okay.
Like a rainbow, so my life made colorful. If you don't know, a life with this man is beautiful. Sing to the glory of God.
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 It's He I know. Everywhere I go, it's He I see. Anything I do, it's He I go. Seeking first all things.
My name is Dr. Emmanuel Kambere Ujakin, the CEO of Zoe Medical Center, Tamale and at Brownville. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or detain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we become our clients. Thank you.
Welcome back to the Reflection Show. You know, this topic is so interesting. I'm just thinking about a lot of things and then remembering a lot of things. Yeah. Young people, we say use condoms, we say you won't use, and we are having so much increase in HIV/AIDS infections, STIs, and a high increase in teenage pregnancies, which can be prevented by just one thing, using a condom. I don't want to talk much.
Yeah.
I'll let Mr. Nuhu say a lot of things. Before some of you come and say, Martha said something. I didn't say anything today, so please. Mr. Nuhu,
yes.
Let's go back to the education. Do you think that the Ghana AIDS Commission is doing enough?
Oh, yes. I said that, these questions should have been directed to the young people themselves. What is
No,
important?
I mean in the education.
What is important is that as much as possible, as you may be aware in the past, we have engaged civil society organizations who go into the community level and talk to people with regards to so many things, with regards to condom use, with regards to even appreciate the HIV infection dynamics and linking people to care.
Yeah.
We have done a lot in this area.
Okay.
But what is important is today the social media is very easily accessible.
Yeah.
We want to employ the young people to what? To make good use of the social media.
Okay.
You can ask any question. You can appreciate the need for you to use condom and to adopt other behaviors that can help you from staying safe as far as HIV infection is concerned. Now, what we are doing is that, in fact, the church is very helpful in this regard. Today, we have some churches who have workplace HIV programs, and they do a lot of HIV sensitization in the church.
Okay.
That is what we want to see happening. We have made sure that we try to liaise with the churches, we work with them, and they themselves are now seeing it as a workplace program and they are implementing measures in it. That is the area we want to go. We want to see an increase in that area. Every church grouping, we want to see that they
And how
make
about
sure
the
that-
mosque?
The mosque, I will come to it, and that's very critical. We are looking at the entire religious settings. Now, what we are currently advocating is for it to be part of the mosque sermons, especially the Friday prayers. Anytime they are going for Friday prayers, they have an opportunity to meet with so many people. We are advocating that HIV and AIDS should be a topic of every Friday mosque sermon. That way, we are reaching out to so many
young people.
and then we are able to, get the message sink into the young people.
Okay.
It's very critical. You see, we have to make good use of the existing structures today. We can't run away from the fact that the Christian groupings, the Muslim groupings, they control all of us. Somehow we reach out to them in the congregation. We need to make good use of these platforms. And that's why anytime we have this opportunity, we appeal to them before they so that they can make good use of their platforms, so that our message can go far. We have done it in the past, but we need to continue. When we do that, we continue to remind our young people of how to live an informed life as far as HIV is concerned.
Okay, so if I get you, you go to the schools, you go to the churches, you go to the mosque, and social media as well, and TV and radio. Now, we are not delving into what HIV is about, whether it's maybe the definition of HIV and how it's transmitted and all of that. Because I believe that over the years, everybody hearing about HIV knows what HIV is. But right now, I want us to delve more. Me as a young person, watching you, or maybe somebody's out there who is watching the show now, how will I be able to really, really take care of myself? Now, let me talk about the antiretroviral drug so that you can chip in into that. Is it affordable? Is it accessible? And is it available?
Yes, let me tell you what we are doing currently. In fact, as a commission, we have worked with the various institutions and the partners. So the Ghana Health Service is doing a lot in this regard. Currently, we have expanded our elimination of mother-to-child transmission programs. So the number of health facilities who were offering this service, we have increased it so that they can take care of the pregnant.
Where can I access antiretrovirals here in Tamale?
In fact, you can, all the hospitals in town,
So
all
I
hospitals,
just walk.
you just walk in. Of course, they will take
Is
you
it free?
through. It's free. It's free.
Is it available?
It's available.
Is it accessible?
It's available. It's free. It's accessible. When you go walk into any of the hospitals, into of the, all the
But
major
I've been
health
hearing that
centers,
sometimes there are shortages.
we have never experienced shortages
Never?
in northern region.
I wish I had my
We ha-
evidence available here.
We have
Never
we
since
have-
HIV, since the drugs came into existence, we have never had shortage in Tamale or even elsewhere in the hospitals.
So you see, as far as I am concerned, being part of the system, northern region, we have never, experienced any shortages as far as treatment in terms of drugs are concerned. Now, what happens is that sometimes if you hear of any shortage, then the problem is within the health facility. but not
They are hoarding it.
Not hoarding.
Okay.
Sometimes the system. You see, when you go to the health facility, we are trying to make it so very easy to access it. So when you get to the health facility, you have a particular treatment center within the hospital.
Okay.
And because of other procedures within the hospital, the stores will go for the drugs. So the drugs and what have you will be at the stores. And then the facility that is administering
Would have
HIV
to go and
will
pick
have
it
to
up.
go and pick it from there using a procedure, an internal procedure. You understand?
For the
And
stores, bookkeeping and all of that.
Exactly. So when you hear then any shortage, then the gap is within a facility.
Meaning
but
that
not
the pharmacy haven't gone to the stores to pick it up.
exactly. Either the pharmacy or the treatment center haven't gone to their store to pick it up, or the health facility itself delayed in picking it from the regional medical stores.
Okay, sir.
But beyond that,
Uh-huh.
we don't have shortages as a region. The medical store will always have drugs that is.
So,
coming.
is the Ghana AIDS Commission reiterating the facilities or the stores to always make this available?
Yes.
Because for me to even walk to a hospital to go and ask for the antiretroviral, it takes some kind of courage. So if I go 2 or 3 times and I don't get it, I might not go back.
No, what happens is that there's a procedure. You just don't walk into a facility looking for.
No, I mean after maybe I have been tested and I have been assigned to a facility.
Exactly.
And I go there for 2 or 3 times and it's not there.
Yeah, I mean,
It can be
so
depressing.
fortunately, we are not experiencing it, but it can be depressing. We are very much aware.
Really?
And that's why we are doing a lot of monitoring.
I'm surprised.
And yeah, Northern region, we are very,
Okay.
I'll
have you on the show again.
Yeah, we are very happy to have that kind of systems
Okay.
and to have that because we work in partnership. So as much as possible, look, we have gone on a trip on a monitoring field, and sometimes we have to stop the field, go back to the regional medical stores and find a way of getting either HIV test kits or drugs to a particular facility. This is because if you monitor, if you check the books and you see that their stock level is so low that and they don't have some within the facility,
Then you have to rush
try
to get them
try to
some.
find a way to help them.
Okay.
There are other challenges that may account for this.
Okay.
But fortunately, we are not having that problems in the
Okay.
northern region for a long time.
Okay, when I get my evidence, I'll give you a call.
Go ahead. We welcome those ideas.
I'll
and then
give
we
you a
can-
call.
yes.
So let's quickly look at the testing.
Yeah.
You know, for me to go to test, it's quite difficult.
Yeah.
So how can I be guaranteed that I remember during my conference in 2019, the Ghana AIDS Commission was there, and I can't say this on air, but let's leave my conference out. So assuming you test someone and the person is positive,
Yeah.
what is the procedure? Not just the Ghana AIDS Commission
Yeah.
staff, but if I go anywhere to test, what should I expect from the one testing me? And how do I guarantee that it's confidential?
Yes. So feel free to go into any
No, I'm
health
not feel
facility.
free. Like we've been hearing it, we've heard it so many times,
Yeah.
but there are very few times actually that I've heard that somebody went to went for an HIV test, and it was positive and the information wasn't handled well.
Yeah.
If it's you who experienced that, you come and tell me as your friend, I will never go to have an HIV test. I want you to assure me and my viewers that if I walk into any facility or if I hear that Ghana AIDS Commission is having free testing anywhere, I can feel comfortable walk in there and have my confidentiality. It's easy to come and say, oh, I'm negative because you are negative.
Yeah.
But what if it's positive? What do I do?
So what you need to do is that you say, yes, it's true. We have experienced that in the past, even in some research work, in some other data gathering. This is real. So, I mean, you are not far-fetched to express this feeling. But what I want to assure you is that we continue to build the capacity of the health facility, of the health workers, especially those who are handling some of these
By
issues.
training them more.
By training them, giving them more sensitization, making, the necessary information and resources available for them to be effective and efficient. It is not normal for that to happen. But what we are saying is that I think that we should all feel free to test and to know our HIV status. The confidentiality today has been guaranteed in our current Ghana AIDS Commission Act. We have revised our act from 2002, the act that established the Ghana AIDS Commission. We have worked with it for some time now. Some of these issues inform the revision of that act. So we are now working with a new act. That is the Act 2016-938. Now, in this act, we have tried to emphasize the need for people to feel free and go and test and know their HIV status by guaranteeing, making certain provisions in it to let people aware that your confidentiality is guaranteed. If something should happen otherwise, then the legal document will deal with.
So I can sue anyone who releases my HIV test results without my consent.
Now it's very clear and very specifically stated in the current act that you have the right to sue anybody who discloses your HIV status. There are procedures of how to disclose somebody's status. Even among married couples, you cannot disclose any person's HIV status to any third party. So if I am the doctor and you are the patient, there's no way I can disclose you or you can disclose my status to my partner. There's no way you can do that. The nurses have the right to do that, but under certain conditions. Okay? You also have the right to do it, but under certain conditions. So you are assured. And let me give you one striking information. Majority of the persons living with HIV do not disclose their status to their partners. Why? Because the health practitioner cannot disclose to their partner. And they, because
so
of
thereby
other
infecting
issues.
your partner.
Exactly. So these things happens, but because of treatment, many of the instances, because the viral load would have reduced, there's no infection.
And then sometimes when the viral load reduces, you go to test and you can even get a negative.
Yeah, you can get
like that if you
non-reactive.
take the treatment for a very long
Exactly.
time.
It's about the viral load and the activeness of the virus in your system. So that is why we have the HIV, you have the AIDS. At that time where the virus, which is the HIV, in your system, and you are able to offer a treatment, you can never get to the AIDS stage, and then the virus will be weakened, and at that point the load will reduce, and then you are healthy, you are strong, and then at most of the time you go and test, and the doctors will tell you it's undetectable. So that is very critical. Feel free, please. Let me assure you, today there's a regulation, there's an app that gives people living with HIV the power, and that gives you, the one who is going to test, and that gives even the health provider very strong backing to make sure that the data about HIV is safeguarded, and that people feel free and to want to test for their HIV status.
And of course, you have to feel free to go in and test for HIV, especially before you get married or when you're about to get married. You have to go and test so that you don't infect your partner with HIV or AIDS. Let's go for a break. We'll be right back.
My name is Dr. Emmanuel Kamberu-Jackie, the CEO of Zoe Medical Center, Tamale and Adekranfo. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or detain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we come out.
Yele, yele, yela, yele. Praise the Lord, Whoa. Yeah. Are you ready? Okay.
Like a rainbow, so my life made colorful. If you don't know, a life with this man is beautiful. Sing to the glory of God.
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 It's He I know, Everywhere I go, it's he I see. Anything I do, it's he I go. See.
You see this topic here, we need to have an open discussion about HIV. So we are asking ourselves whether at what point do you really have to test? Is it while you are there to test as a single, or is compulsory to check your HIV status before you get married? I think this would be like a very big topic on its own, and I need a lot of young people in my studio to debate this out. Sir, I want you to help me understand the practical education steps. So you are speaking to me and everything. Now, if I'm there, do I just come and say I want to do HIV test, or you're going to educate me before you take my blood sample?
Yeah, so there's a procedure, there are even guidelines to this effect. Now, the simple procedure is that you are informed, you are educated before they test you, and after the testing, you are also informed, you are educated.
Okay.
So you need to know that the doctor or the nurse need to let the client know that, oh, I'm going to give you HIV testing, or I'm going to test you for HIV, I'm going to take your blood, and this is the reason why I'm taking your blood. And if it is about HIV, the nurse or the doctor need to explain to you what the HIV is, what are the possible outcomes, and if it is negative, if it is active or non-reactive, what are the issues, even before the person does the test to you. And after the test, whether your results is non-reactive or active, then the nurse or the doctor need to also explain to you what the results is and then what you need to do moving forward.
So what are some of the reasons of the high recorded cases? We mentioned the why most of us don't want to use condoms. And why do you think we don't want to use condoms? I mean, young people don't.
I love that, and I look forward to a day that you bring together young people, so that we can discuss this.
Oh, I can't wait for that.
It's very interesting.
We'll have them.
And unfortunately, because of pleasure, certain pleasures, people think that the condom is not giving you,
it's not
them
pleasurable,
the right satisfaction and all that, and therefore they are not using it, and it's very difficult. Meanwhile, the condom, we have the female condom, we have the male condom.
I'm just imagining if pregnancy is more pleasurable than
or HIV
or STI.
I think that is the reason why people just want to experience a raw, and therefore they are not using it. And sometimes it's under certain influences, and that's why we are advised that always move with condom. Do
you think parents have a role? Parents have a role to play in making sure that their children are not at high risk of HIV/AIDS?
Very important role. Education.
How?
Education, and explain to them beyond the school education. When they come, like I give you an example in my house, the condom is everywhere, and they appreciate. Sometimes when I go for programs, if my children are free, some of them, those who are grown, they go with me. So they really appreciate when we are doing the education.
It's not possible to know at what point we just go and have sex.
Exactly. Yeah. That's why you have to move with condom all the time. So if you actually check your bag, you as your bag, our colleagues, you should have condom in your bag. This is very critical. We are all adults.
Emergency.
The young people, emergency. You don't know at which point that you need to have sex. It's very critical. Control it. But if in the case that you cannot control, you just have to do sex, go with condom. It should not be difficult for us to use condom.
Do you think that we have moved from the education of abstinence and we are more on the education of using condom? That is why more people, or maybe you have sex, that's why more people are not able to abstain. Or you feel that the abstinence education have gone on and they are not abstaining. So whether we talk about abstinence or not, they will still want to have sex.
Matter.
Yes.
The reality is that we just have to talk about condom use. If you look at other data, we cannot do anything about it. Even in the church, even in the mosques, in the various, you see that the pregnancy, the teenage pregnancy, and we don't like it, abortions here and there. HIV infection,
And
STIs,
safe abortions, especially.
So you see, as Ghana AIDS Commission, we are not ruling out the need for us to preach abstinence. It's very critical. It's very, very important. But we are saying that let us also let the young people appreciate what condom is and
Okay.
why they should use condom.
Okay.
So the reality is that we have to talk about condom in the church, in the mosque, in our rooms, in our houses, in the school, wherever we go, so that we can protect ourselves, all of us, not only the young people.
I'm just thinking
That's the reality.
something funny. So condom should be like a nose mask that you have in your purse everywhere you go just because of emergency.
That is what we want to see happening.
But someone is there. You are not sexually active. You know very well that your day in and day out activities, there's nothing that really push you
Yeah.
to go have sex. Like, for example, we come on sets, maybe by 7 a.m. we are out on set.
Yeah.
You are doing productions. You are planning for a conference or
Yeah.
there. You go home at 9 p.m. You don't even think about anything about having sex. Is it still compulsory to keep a condom in your bag?
You know something? You can help somebody. I cannot imagine, and I cannot tell you the number of times that I have helped people. People come and knock at your door. People call you midnight. And you can't imagine the kind of people who make these calls. And you help them, okay? Because it's an emergency
I'm coming.
situation.
People call you or they see you in town
Yeah.
and they're about to go and do. So they easily ask you to just give them the condom.
See, I know that this night or this afternoon or around this time, I will
Meet
I
your
will,
girlfriend
I will
or
meet my
boyfriend.
girlfriend, and anything can happen. Or I will meet him with my wife. My wife who is still having a baby, and anything can happen. Okay, and then I will need some protection.
Maybe condoms are not accessible because for me to walk into a pharmacy like me, and I'll just go and I'll be like, oh, good afternoon, madam, or say, and like, what do you want to buy? And I'm like, I want to buy a condom.
it's happening.
I think it's one reason why I think so. Are there measures where the Ghana AIDS Commission is trying to make condoms accessible, available, that I don't have to go to a place that I have to feel shy to get a condom? I think it's still one thing that do you have helplines where I can just, I want a condom, that the condoms can be delivered to me wherever I am?
Yeah. Now, so this is what we are doing. We have done in the past, and we continue to do that. We have tried as much as possible to come out with a machine that we call condom vending machine.
I've seen some with a lot of NGOs.
You see, we are just doing what we can because we appreciate these challenges.
But most times you go and condoms are
are not there because there are challenges. And you know the funny thing, you slot 10 pesos coin and you get 3 pieces of condom. And the funny thing is that people go and insert different objects instead of the 10 pesos coin to get the 3 pieces
They
of
can't
condom.
even afford 10 pesos.
And when that happens, a lot of our machines are breaking down. And that is why we want to take this opportunity to let people be aware that the machines are there to help them. So as much as possible, they should try to take care of the machines for us. Every now and then we repair these machines. In some of the places, we just remove them because you repair it this morning, in the afternoon, the machine is down again. So we have changed it over and over. So we are still saying that people should make good use of a condom vending machine.
Please.
Now, what we are also doing...
I just want to get this note out to my viewers out there. Please, from the Ghana AIDS Commission and all the health NGOs that work on young people's reproductive health, they are saying that when they put the condom vending machines out there, take care of them. Because when they get spoiled, it increases the our risk of getting HIV/AIDS and teenage pregnancies and STIs. So please, we beg, when you see the condom vending machines, take care of them because they are going to help be ourselves and they're going to be sustainable for us to live a healthy life. Yeah.
Let me add that, our offices are very open. The doors is such that anytime you need
Where
a
is
condom,
your office in Tamale?
we are located at the Regional Coordinating Council. So you can always reach out to us, whether you want to know your HIV status, whether you want
So I can
condom.
come to the office and just test.
Oh yes, very fortunate. We have a health facility as part of our setup.
Okay.
The Regional Coordinating Council is very much interested. That's why we are pushing for every institution to have a workplace HIV program. So beyond just trying to take care of the health needs of the people, they are also mindful of the HIV workplace program. So the RCC with all of us. We've gotten a health facility at our end. You can know your HIV status there. You can come. We can help you with condom. Not just giving you condom. We'll give you leaflets that will help you to appreciate both male and female condom.
Do you think that the education on the right use of condom is also a reason why people do not use condom or do not use it properly or don't know how to use it? Or do you think that education on condoms is should be done more properly?
Yes,
because some people say that some of the condoms it gets bad.
Yeah.
So do you think that the AIDS Commission do not purchase quality condoms?
Oh no, we provide standard condoms. AIDS Commission doesn't go and procure condom. We go through all the procurement procedure and we use the practitioners, the professionals, the Ghana Health Service. We use the Ghana Health Service and all that to procure condom. If you want the good condom, rather go for the Ghana AIDS Commission, the Ghana Health Service condom, because we make sure that the standard, everything, we don't pass it through any illegal means to bring it condom.
Do you think the FDA is also helping? Because you see a lot of condom brands and everything, is approved by the FDA. Yeah. It's approved by the FDA.
Now, the thing is that, you see, until we get these experiences, the condom bars and all those, we don't have data on, then in terms of new infection, how many were a result of, and all those things. But we agree, and that's why we are also coming out with a campaign. Very soon you will see us on the street and everywhere campaigning for condom, not just male condom, but the female condom. We agree with you. We need to increase our education.
People don't like using the female condom.
But let me tell you something. The female condom is wonderful. Let me tell you why.
Before you tell me about how wonderful the female condom is, let me go for a break. My hair is by Vpex Beauty Salon here in Tamale. My makeup is by Makeup Marvin. My address is by Root Suits and More. Shoes by Ennis Collections. Our refreshment is by Trillium Industry Limited here. You can contact patients on 0241 760 9754. Wonderful packages. Zoe Medical Center, thank you very much. Events happen GH for our wonderful furniture here on set, and Dio Restaurant, always giving us sumptuous meals to keep us strong anytime we are on set. I have been speaking with Mr. Nuhu Musa. He's the technical coordinator of the Ghana AIDS Commission, technical support unit for Northern, Savannah, and Upper East regions. My name is Martha Anabila. We'll be right back.
My name is Dr. Emmanuel Kambere Buchakin, the CEO of Zoe Medical Center, Tamale, and at Brownville. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or detain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we come out.
Yele, yele, yela, yele. Praise the Lord, Whoa. Yeah. Are you ready? Okay.
Like a rainbow, so my life made colorful. If you don't know, a life with this man is beautiful. Sing to the glory of God.
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 It's He I know. Everywhere I go, it's He I see. Anything I do, it's He I go.
welcome back from the break. It's still the HIV/AIDS discussion here, and you know what? Behind the scenes, we are having so much discussion here. We need to do a part 2 of this topic, and I have to invite a lot of young people into the studio to debate on some of why they are using condoms or why they don't want to use condoms. And I think that it will make us to understand the best way to go. I have been speaking with Mr. Nuhu Musa, he's the technical coordinator for the Ghana AIDS Commission Technical Support Unit for Northern, Savannah, and Northeast regions. He's a big man. Now 5 northern regions, I think. Yeah. Okay. So we are yet to talk about that wonderful thing you were about saying about the female condom.
I mean, what I want to say is that, look, instead of the male condom, you need to put it on when you're about to engage in the sex activity. But female condom, you can put it on for more than even 2 hours before. Yes. So you know that very soon, the next few hours, I'm going to engage in sex.
No,
you
but
can put it on even whilst in the kitchen.
Oh
Yes, you put on your
really?
condom. Yes. So that's one
Sorry.
beautiful thing about it. So you see, you can
Sorry,
put
I
it
didn't
on
mean to
ahead
laugh.
of time. You see.
No, like, okay. I'm
Yeah.
just,
So you see that, isn't it interesting? You don't need to rush to put it on. Female condom, you take your time, you put it on.
no, is it, maybe you can put it on before you lie down, but putting it on even,
So that is why it is even more interesting. Maybe as you put it on, now your mind will begin to know that,
Psyching your mind of what is
in the
going to
next
happen.
days, in the next day, that will even make the sex more pleasurable.
Eish.
And that's why we are advocating for the use of a female condom. Unfortunately, the female doesn't want to use the female condom, but it's very important. And as I indicated,
sometimes
it
the
is more-
misconceptions are here. I learned it's
Yeah.
quite painful. Trying to insert
Set it,
insights and
all
all
those.
of that is quite painful.
Yeah, I mean, that's what we hear. But I think that if you look at
Maybe
the
because you're not
advantages,
a woman,
yeah, that's why I'm saying that.
do you know women who have personally tried it and they have given you their...
You know, when you are in this area, you want to try a lot of things because you want to talk with evidence and practical issues. You want to have a little idea
But
of
do
it.
you know a
We
woman
have
who has-
tried it. I
okay.
have tried it before.
Oh, okay.
And then we enjoyed it.
Hey,
I dare you to try it. You will enjoy it.
okay.
So, but what
When I
is
get
important
married,
is why we need to use condom. Okay? It is not about any ill mind, but it is because we want to reduce, if not eliminate, new infections as far as STDs, HIV, and early pregnancy is concerned. That is what is important. That's why we must develop the habit of, using condom, whether being it male or female condom is very critical.
So now, our senior high school students, I have been doing a lot of mentoring, organizing a number of conferences and mentorship summits at that level and even the tertiary level.
Yeah.
You hear a lot of students even going in for abortions, having unsafe, especially unsafe abortions. And sometimes I feel that, is it that the senior, like when you go to the senior high schools, personally, I used to work with an NGO that deals with reproductive health. When you go there, you are not allowed to give the students condoms.
Yeah.
But you go back again, or even before that education, the teachers will be like, talk to them. Oh, some of our girls are just getting pregnant anyhow.
Yeah.
But you go there, you want to give them condoms, and they say that GES does not allow you to give condoms to the students.
Yeah.
But there are students who are getting pregnant in schools. There are young boys having sex in schools.
Yeah.
How are you collaborating with GES to understand that whether we like it or not, our senior high school students are having sex? 2 weeks ago, I have a friend who is a teacher in one of the senior high schools in Ghana. And she was telling me about a girl who almost died because she had an unsafe abortion. She was bleeding seriously, and she was like, she had stomach. So they were giving her antibiotics thinking that it was her stomach. They had to rush her to the hospital with an ambulance. So they kept asking, she was like, her stomach, until one nurse easily asked and said that, oh, is it possible that you had an abortion? And she had to confess. How are you working with the Ghana Education Service to make sure that you can make condoms available in senior high schools?
You see, the story you have narrated, I will come for the video later. You know why? We want to give that narration. We want to play it over and over in our schools so that even the parent will have the benefit of listening and hearing this story that you have told. You see? And that is why we are currently reviving our HIV school alert program.
Okay.
You know, there used to be this program in schools where HIV programs are taught in school and they try to form clubs here and there. And I must say that we just came from GES to your studio.
Okay.
And then we are now trying to revive that program in the schools.
Okay.
So we are working with GES to revive the HIV school alert program in the
I
schools.
hope it comes on. When it comes on, I'm really going to invite you on GES back into the studio to see if the collaboration is realistic and not just theory.
Yeah. Now, what we are
Give me your
telling them,
final words. Yeah.
what we are doing is that, you know, we are working with the health coordinators in the various schools. So we give them,
I don't want to go there, but with the
we
health
give them-
coordinators,
Yeah.
are we sure they are really working?
oh yes, for us in the area of HIV, it is a very practical, it's a practical issue. So they form the clubs, we go into the school,
Mr.
we
Nuhu,
work
I'll give
with
you
the
a lot of
clubs.
evidence with the things I'm saying.
Yeah, it's very important. That's why
okay.
we need to
We'll have
improve
a
the
part
system.
2 of this.
Exactly.
I'll call you back. We'll have a
Exactly.
part 2. And I know after this episode, take our WhatsApp number. Send us your questions on HIV or anything you want to ask GES, Ghana AIDS Commission, or anyone you want to ask. So that it helps us to find the right questions. But after this episode, I'm going to do my homework well. And I'm going to hit you hard the next time you come here. Give me your final words in 10 seconds.
Oh, so let me say that as young person, as young people, we, as much as possible, we should try to know our HIV status.
Okay.
We should try to talk positive things about HIV.
Okay.
Because stigma and discrimination is rare and
Okay.
it's putting people away from getting to know their HIV status.
Okay.
People should not forget that there's no cure for HIV yet, but
Okay.
there's treatment for HIV.
There's no
And
vaccine
that-
too.
And that when you are infected with HIV, your life goes on because you can be treated, you
Okay.
can live a normal life,
All right.
and then you are safe. You are good to
Thank you very much for coming. We'll have a part 2 of this. At that time, I'm going to have a lot of evidence here. Books, files, videos to child, especially you saying that you have never experienced shortages of the antiretroviral drugs in the northern region. Okay, thank you very much for watching. I have been speaking with Mr. Nuhu Musa. He's the technical coordinator for the Ghana AIDS Commission, technical support unit for Northern Savannah and Northeast regions. It's been a very beautiful and a wonderful show. My hair is by Vipex Beauty Salon, makeup by Makeup Marvin, host. My outfit is by Roots Suits and More, shoes by Ennis Collections, refreshment by Trillium Industry Limited, Zoe Medical Center. Thank you very much for supporting the show. Events happen, always giving us wonderful and beautiful chairs for our episodes. And Dio Restaurant at the Agric main traffic light here in Tamale. Please do give them a call for all your sumptuous meals for any occasion that you have. My name is Martha Anabila. Always a pleasure to meet you with wonderful content.